Okay, and we are live. We'd like to welcome everyone to this session of our Expert Advice Live session. We're going to be talking today about core competencies. So these are the competencies that a health professional school is going to be looking for when they are reviewing your application. And they fall into a number of different categories. There's different types of competencies. And so I will turn it over to our Director of Advising Services, Emil Cuck, who is going to talk more about competencies. And should we just go ahead and start with the first question of what competencies are?
Yeah, let's go ahead and do that.
Okay, so what are the core competencies?
So again, thank you for all of you guys that are coming in. I'm going to do this approach a little bit broader than just medicine or US medicine, just because there's so much that's out there, but I wanted to give a little bit of a larger view. So core competencies in terms of the thought of what exactly are we looking for core competencies. This really stems from maybe a decades long conversation among health professionals about what exactly makes a health professional, whether you're a doctor, you're a dentist, a pharmacist, or whatever, and what are the qualities that we would look for the ideal health practitioner under those circumstances. So we all, over the many decades, there was always a discussion of, what makes this type of professional who we would like to have. What are the qualities that we really want among our profession? So over the various years leading up to about 2010, this is where the conversation was going, and it certainly was at the highest level of all the major professional societies, not just in the United States, but around the world. So the context, or what we're thinking about, the framework of core competencies, are basically the attributes, the skills, the background, the foundation that really defines a professional. What should that look like? And how do we provide language to really talk to people about what makes someone truly a professional? So core competencies is a framework that really gives us an idea of what we would want from anybody who we would trust as a doctor or a dentist or whatever. So, I will start off basically saying, again, this real movement for the purposes of medical school admissions really came on the forefront around the mid 2000s to the early 2010s. It coincided a little bit with the development of of now what's known as the 2015 MCAT, the newest version of the MCAT that's in play for about 10 years. And all throughout that discussion, there was some understanding or recognition of reframing admissions, especially for more holistic review. And we will get into that maybe a little bit later on. So core competencies basically are defined into three major domains for most of at least major health professions and pre-med. And AAMC really has taken the lead. Most of the other health professions are kind of following along and pretty much saying, we don't really have anything to argue with them about. So what makes a health professional, at least at the doctoral level, someone that we would trust? Well, we trust them because they have a solid academic foundation. They know their science, they know their biology, they know their pharmacology, they know all the things that they need to know in order for you to associate them with the title, being a doctor, certainly being a dentist, being an optometrist. They are experts in their field. So having that core knowledge is really important, and also understanding what are the skills that you need to sort of build your knowledge, adapt your knowledge to new information that is sort of the leading edge of your profession. So that starts going into a little bit of a broader spectrum. So aside from your core knowledge, you need to be able to be adaptable, to acquire new knowledge, and to be able to understand and read literature and really figure out, is this relevant to my practice or not? So in addition to, I guess I'll use the AAMC's term, the science competencies, they have thinking and reasoning competencies, or what I like to call collectively together the academic competencies. There's a paper that I wrote about the academic competencies in general. I don't go into the details about the science foundation. I mean, I think most of us know, what, basics of biology and chemistry and all the things that you need in order for you to have a profession. But you need to also understand how to process new information germane to that body of knowledge. So how do you critically assess and analyze new literature, new publications, and try to assess, is the data analysis solid? Are there things that you can do if you wanted to develop a hypothesis or try to infer information from those, from what you're gathering? So a lot of those additional competencies on the academic side, as I like to call them, so they will term them as scientific inquiry, critical thinking, and quantitative reasoning, and certainly the ability to summarize in terms of written communication. They put it under the academic competencies too. These are all these are all skills that any quote unquote scientist or anybody who's learned in the field who wants to stay current in their field needs to be able to do. So those are academic competencies. And I think most of us have long recognized the importance of having these types of skills to have a sustainable career as a health professional. What has largely been left until recently, a little bit less well addressed, has been the concept of, quote, professionalism in terms of behaviors. You'll hear them termed as soft skills. I've heard them termed as power skills. Whatever language that you happen to use in the career services line of thinking, these are the other so-called other skills that are very important for you to actually establish trust with a patient, and as well as obviously the rest of your peers in the profession. So a lot of these other competencies are also very important. Back in 2011, there was, I think, overall a total number of 15 competencies, which includes the scientific ones or the academic ones and the pre-professional ones. And there, I believe there were 9 counted at that time. They recently, about a year or two ago, did a revision. And so now there are 11 pre-professional competencies. Don't worry, it's not really that different, but that's just much clearer definition of what those competencies really are. And so these are things that I would encourage you, if you are in a medical field, to really look them up and see what they're really all about. And I think for anyone in a health professional field, you probably can't argue with any of them. Having a commitment to learning and growth. So not just having the toolkit so that you can grow your knowledge and stay current, but being committed to always improving yourself, and not just, in terms of your body of knowledge, but your own practice and the soft skills. Those things are extremely important. And I don't think you're going to have anybody arguing that you need to make sure you have the ability to reflect upon the things that you've learned, how you learn, how you present yourself, and and modify yourself, and make yourself grow as a professional. Cultural awareness and cultural humility. These are 2 different concepts that basically says that you're aware that, the way that you have lived your experiences and the culture that you've grown up with is not the only one that dominates around the world. And you are certainly aware that there are other cultures or other historical influences that happen that allow you to better understand other people, other populations, other groups. Cultural humility means that you have the willingness to actually learn and engage with other people in a manner that stokes curiosity, stokes at least an entry level into trusting somebody else and learning more about who they are, where they're coming from, and what their beliefs are, what their values are, what their customs are. That's really important, to really be able to understand, not just to learn about it, but to also really, truly, deeply understand on an individual level and a community level. That lends itself to empathy and compassion. And so this is the emotional need to connect with people, in addition to the curiosity of learning what other people are like. You want to truly be honest enough and actually be interested in somebody else. And when you're working with somebody, you really are doing it honestly and out of the goodness of your heart, if you will put it that way. I'm just going down the main list: ethical responsibility to self and others. So, you are doing things certainly out of empathy and compassion, but also possibly out of some sense of right, of duty, of justice, whatever those concepts really are. So having the integrity to know, when you're working or you're doing something on behalf of, your self-interest versus collective interest, you have to know how to navigate that. And certainly with the professional expectations that we place upon them, we want to make sure that you behave and comport yourself in a way that is consistent with whatever the image, as it were, or the vision of the profession really is. So understanding what those ethical principles are, And really learning to live up to them is really important. And we may go into what those ethical responsibilities are and how they're articulated later. Interpersonal skills, certainly getting to know other people and how do you work, how do you manage or work with other people in terms of communicating with them, which goes into oral communication or written communication, all those sorts of things. The importance of being a trustworthy individual who's a professional really comes into play. So the other two concepts of reliability, dependability, and resilience and adaptability also come into play too, because if you're going to be a professional, you've got to be reliable enough that you've earned other people's trust. And you have to learn how to adapt if things are always changing in a manner that is still appropriate for you as a professional, and does not put at risk any other relationships that you are having professionally with the people that you're serving. That goes to service orientation. So obviously a commitment to improving your community, making sure that you can advocate for your community for all the needs that they have, not just medical or health related, but also externally to that. And obviously there's a lot of teamwork and collaboration that comes into play. Very rarely are you practicing in solo. So understanding what the system around you that supports you is like, having to work with peers, having to work with direct reports, having to be managed, as well as your own, patients. They're all important. So I basically ran through all of those power skills, those pre-professional competencies. You not only have to understand what they are, you have to at least understand how to live those experiences, through all the activities that you put on your application. And you also have to be able to understand, how this is very important for your ultimate professional identity formation. When you become that type of professional, what you want to be, how do you approach it, and how do you understand how these competencies all really work and interact with each other? So core competencies in this way is this nice framework that allows us to really talk about professionalism, trust, all of the things that I think make a professional, quote, a professional.
Okay, well, that really breaks it down, and there's certainly a lot of different competencies that students and would-be health providers need to have as part of their toolkit. One thing that we'll often hear about also is technical standards. So can you kind of break down what's the difference between competencies and technical standards?
So competencies, basically, as the framework is really meant to discuss professionalism and forming, what are the expectations of the professional field. Now, technical standards also overlaps quite a bit and in my mind, they are just as important as core competencies, because every single school needs to articulate what are the expectations we have for our students to have the types of skills and the knowledge and the sort of characteristics that would allow them to successfully graduate from their program. This comes from the fact that in a lot of cases, we ask you to do a lot of things. So core competencies is sort of about more values oriented, but technical standards really goes to the fact that, when you're learning about health professions, you actually are going to have to do some things and you need to be capable of doing them. So I've pulled up in a different screen and you're not going to be able to see it. But I have it's not just medical school. All the health profession schools have it. So I have right here like a program in pharmacy, and they actually have it listed. These are the technical standards essential for admission, progression, and graduation. And this means that it's meant to be an agreement, if you will, between the students that come in with certain skills and what skills they're going to need to improve upon or work on in order for them to be able to graduate. This is also very important because I know many people who are applying also have to deal with the questions of accommodations. So you have certain disabilities, either visible or invisible. And there's always some question on whether you are able to complete the curriculum if there's not a way for you to manage or handle an adaptation to a reasonable adaptation to whatever disability you have in order for you to be able to progress through the curriculum. And so this is sort of the baseline for everyone who has to deal with accommodations. And these are the technical standards that basically if you are going to be considered for admission and you have a disability or you have something that you might be concerned might not have, you may need some help in order to complete the course of study. These are the things that the school or the program promises they have in terms of expecting you to be able to do certain things. And if they admit you, we will go through whatever legal process exists out there in order to provide you appropriate accommodations, whether it's for testing, whether it's for hand skills or whatever else. So some of the capabilities or these attributes, these technical standards include things that are pretty simple. Like you must be able to know how to observe things and describe what you see or describe what you hear. And if you're able to discern very subtle changes in whether it's vision or color or or whatever, the sensory observation skills have to be solid enough that you could pass through the curriculum as best as you can. Certainly, communication skills are very important. If you can't articulate in writing or in spoken word what you're seeing, there's going to be challenges to that. And being able to communicate with patients, of course, is a very, very important. It's in the competencies, but it's also extremely important for you to be able to complete your course of study if you're taking care of patients. You need to be able to communicate with everybody, whether it's your patients, the people who supervise you, or your peers. And then we go into other sort of adjustments in terms of being able to appropriately comport yourself as a professional, being able to have appropriate hand skills or motor skills if you're able to move things or you have to manipulate things with your hands. I say this because, of course, this is extremely important for dentistry, where I have my background in admissions. Nobody really wants to work with a dentist who is really clumsy with their hands. You don't want to be in that situation. So all of these the other attributes that are listed in technical standards, just be aware that they exist. Many of them incorporate many of the principles that are in core competencies, but they go a little bit step further in terms of things that you have to physically or be able to do or mentally be able to do in order to pass the curriculum. So it's not just the core competencies, it's whether you really can complete the courses and complete the curriculum.
Okay, yeah, I can definitely see for dentists the fine motor skills is obviously a very key element of that job. So it's important that they're able to do that.
Yeah. On the pre-professional competencies rubric paper, which there's a copy that we have on SDN on our articles section, I have included some extra competencies that are really important outside of just medicine. So fine motor skills being one for dentists. Certainly an understanding of holistic medicine is important for osteopathic medicine, and so forth from there. Obviously, veterinary medicine is a little bit different because you got to know animal physiology, but you also have to know some other elements too. There's much more of an emphasis that I put into the supplemental competencies about understanding how to run a practice, so the economics, because chances are if you're an optometrist, a dentist, a veterinarian, and so forth, you likely will be independently practicing. You're not hooked up to a large major medical center or a hospital-based system. So understanding the insurance elements and understanding how to manage a small business is going to be very important and something that you should have some understanding of going in, ideally. So please, if you are at all interested or not necessarily like 100% fully intended on just living and working in a hospital forever, the pre-professional competencies, that entire document is there as a supplement.
Yeah, and I just want to add that we did put that into the chat. So the links to that are in the chat. They're also in the forums thread for this session. So if that is something you're interested in, definitely go check that out. Check out those links. Additionally, if you have any questions, particularly in the area of the competencies, please put those in the comments below and we will try to get to them. If your question is really specific to just you, you might want to go check out our Ask an Expert area on the forums. You might be able to get a better answer there than we can do during this live session. Switching gears here to the next question. You talked a little bit about this in the core competencies description that you did, but why aren't grades and test scores enough? Why are these competencies important?
So, and I think this is something that I think everybody in education understands, that, you know, you can have a lot of really good people who excel really well at board exams, at licensure exams. They know how to process information, and they really like do as best as they can on, you know, simulated exams, clinical exams, or whatever else. But if you get them in front of real patients, it's really challenging. If you put them in a spot in your residency program and you clearly are not meshing with any of your other peers, that's a problem. And so grades and test scores tell us a lot about your ability to understand material, process it very quickly. Again, more the academic competency side of the house. But your real survival, as it were, as a future professional really relies on so many more things, and those other power skills really come into play. I state this in that, you know, if you're going into one of the professions of like dentistry or pharmacy, optometry and so forth, where you really are much more of a private practitioner or solo practitioner, or you might be running corporate, but regardless of it, you know, your ability to stay in your job really relies on your pre-professional, the power skills, as I mentioned. You're not going to be able to attract a lot of patients that will help your practice survive if you don't really have those other skills. And those are not always things that we see that correlate well with, your science GPA or doing well on certain exams. So there's plenty of people anecdotally that can talk about that one resident or that one student that just is clearly, you know, head and shoulders above everybody else, and yet they just did not catch on to all of the other things that they really needed to do to really make the work of the whole clinic or the work of their whole entire group better. There's a reason why, you know, we don't have you take tests in teams, as an example. That would be one way to greatly test your teamwork skills, and that's one of the reasons why so many schools, and I know, you know, when it gets to interviews, oftentimes they will have candidates actually in small groups, and we will see how you work in a group dynamic with other peer applicants and a facilitator or two. So they're good for the purposes of us understanding if you have the solid academic foundation, probably even the ability to be very successful in an academic environment. But if you're going to be working with patients and really getting their trust, you need more.
Yeah, it's not like you said. It's not just you always see, or if you look at the medical school acceptance rates, there's always some students who have amazing MCAT, amazing grades, but who aren't accepted, and it's probably because they're not able to show that they have these competencies that are necessary. So that is a good transition to how do admissions committees assess those competencies and figure out that besides the, like you just mentioned, the teamwork exercise that they might do in an interview, what are some other ways that they assess to see, is this person going to be able to communicate? Are they going to be able to work on a team? Are they going to have those soft skills or professional skills that are going to be necessary in order for them to be a successful healthcare provider?
So this is one of the problems and the challenges we have. Despite the fact that the admissions process lasts 15 months, there's still never enough time to assess these core competencies. I mean, clearly we can give you a multiple choice test to see if you understand the basic concepts of the core competencies, you know, not just straight up definitions, but we can give you case examples and see how would you respond or how effective this response is or another. Boy, that reminds me a lot about situational judgment tests. Well, that's exactly one of the ways admissions committees are using core competencies and assessing how well you do. We're coming up with our next session, of course, is on recorded video interviews. If you don't want to have, if you don't want to rely on exams that come out of a third party, and you want to develop your own set of questions that are analyzed by presumably your own faculty members and others, then you can create a platform that you can do the same thing. So it's not just multiple choice tests. We can also ask questions of you and see how you would answer to situational or behavioral questions. Again, that's a little bit more like Casper. It'll be a little bit more like these recorded video interviews that will be coming up a little bit later. I also mentioned that sometimes if you're in an in-person situation, or certainly with Zoom, you can have small breakout rooms. You can have some sort of a group activity that also assesses some elements of the core competencies. So there's levels of assessment that usually exist. You will have more of those opportunities where those competencies will be assessed once you are in medical or any sort of health professional school. One of the conferences that just finished that I just came out of, we're focusing on professionalism. How do we assess professionalism? Well, we can do it through exams. We can do it through interviews. We can do it through reflection papers. We can do it through, case studies, simulated case studies. We can do it by assessing how well you do, in clinic during rotation. So if you will call it letters of recommendation, that would be one way of doing it too. If you train your references properly. This is something that you're going to be dealing with for all of your academic career once you get into a health professional program. So you're always going to be assessed on professionalism and the competencies that go into being a true professional, and that's part of the reason why you would be promoted or ultimately graduate from a program or graduate from a residency program. So you have to understand the ways that you are performing in a manner that engenders trust, not just with the patient, but also with your peers, also with people who supervise you. Those are all really important. And so, as mentioned, for admissions processes, we have a limited toolkit, but once you're admitted, everything else comes into play. So, in addition to, again, the tests themselves, I will also say admissions committees do often, because of that, as I mentioned before, different ways of assessing, not just with tests, but also with written reflections. So maybe some of those secondary essay questions that we ask you give us a little bit of insight about your core competencies. Maybe some of those activities that you've listed in your primary application essay may point to your understanding and your maturity in some of those core competencies too. I love to tell people that, if you are applying to, and I'm putting medical in quotes here, any sort of health professional or medical school, I believe that everyone has all 11 of these power competencies. I believe you all have. You don't have to show me that you don't have this, that you lack this one competency. Actually, you don't want to say that you lack this one. Everyone has some combination of those competencies developed to some degree. The question is how you at least express that you understand or have some competency, an understanding of these competencies throughout your application. So again, that's where holistic review comes in. And that's where a rubric like the ones that I've published, the mock rubrics that I did, really come into play for anybody who's screening your application at any step. We have a rubric that says, to what level you really have activities that demonstrate your competency. That's what we look for. And that's what we will use to try to compare, or at least try to find out why we like one candidate better than another in a little bit more of a semi-quantitative way. So I wish there was something much more precise, but aside from the obvious situational judgment tests, which are just simply tests, there's a lot of good, reviewers and a lot of good screeners will have rubrics in mind and will look at all the rest of your materials, based on what they see. And that's probably the best way I can answer how we assess core competencies in your application.
Okay, you started to touch on this a little bit, but I think that a good segue into, so if you're a student and you're applying, how do you go about showing where you are developed on those different competency levels? And obviously everybody's a little bit different in different areas, but how do you show those competencies? How can you illustrate those so that it's clear to the reviewers, oh, okay, I'm looking at this rubric and, this person's illustrating that they have good ethical judgment, for example.
Mm-hmm. So I think one of the things that I like to highlight, and I'm probably going to write an article about it at some point, is to really figure out how applicants in general are expressing their core competencies in applications. I certainly can say one of the places that is most noticeable, grabs the most attention, is of course the personal statement. And we did a session on the personal statement a few weeks ago. But a lot of times when people are writing personal statements, they really like to hone in on the rather cliche phrase of helping people. And so empathy and compassion really wind up being one of the most predominant, most common competencies that are highlighted in any of the personal statements. So that's fine. I don't mind that. And I think that's something that resonates very well if you're going into a helping, serving profession, is that you have to show that you are committed to that. The challenge is how do you articulate in a cogent manner your desire to become a professional with just one competency, knowing that you have 10 others that you also have to leverage. It's sort of like, as I tell people, it's like learning and this is not my analogy specifically, but for this particular purpose, it's learning how to type. And back in the days before we had, and maybe even to this point, maybe this is probably appropriate. You probably know how to type on a keyboard with just one finger on each hand. I think we could probably ascribe that to your thumbs, and you type on a screen with your thumbs. And that works really fine and wonderful. But back in whatever the old days when we had an actual keyboard, and we still have keyboards for computers, I don't think you would really enjoy typing all your papers with just one finger or just your thumb on the keyboard. So that's what you're kind of doing. You're really showing empathy and really highlighting it a lot. So the nuance comes into what additional competencies you can sort of weave in and make your story a little bit more complex. What are you spotlighting as your strongest competencies? And those are things that I know many of you who are just trying to wrap up your personal statements are really thinking about right now. And so how do you show you have these kind of core competencies? Just think very carefully about how you are constructing your entire application. When you look at your activities, what are the competencies you're really highlighting? AAMC has this workbook called Anatomy of an Applicant. I certainly say if you don't understand what I'm talking about, go to that workbook. They also will have you do some mini reflections so that you break down, say, think of an activity where you really highlighted and showcased your resiliency, adaptability, how you manage one or the other, and so forth. So you get a chance to really see and think for yourself and write down, or as best as one can, write down an activity that you likely will include in your work and activity section that you feel best showcases your adaptability or your resilience. So there are workbooks that AAMC have that help you articulate that. And so you just have to think about it when it comes to all of your activities. What things are you highlighting along the way? When you think about how you write your personal statement, what are the competencies that you really like to highlight? I've already mentioned empathy and compassion as one. One of my other favorites, because you have much more, many more characters, is the fact that when everyone says, I'm struggling for that narrative, I'm struggling for that theme. Well, one really good theme to have is growth, capacity for growth and improvement. So show me how you grew in certain competencies, or maybe you had a foundational competency, but now you're adding a complexity element. So it's not just empathy and compassion. You learn how to be more culturally sensitive. So this goes into cultural humility and cultural awareness. You might be better served with understanding how that applies to teamwork. So you can see how you can build these competencies together and showcase that you have a maturity, you have a reason to really grow in a certain area. And that makes your essay hopefully a little bit more about you, and sort of on your trajectory, that you're still hopefully, ascending on that arc. And hopefully med school even gets you a little bit further up. So these are just a lot of ideas about looking, if we're doing holistic review, we really rely on all the elements of your application to really let us know and give us insight about that. Yeah, you can't control your letters of recommendation. Hopefully, if you do have input in that, they'll help too. But really, throughout your application, that's just one example, certainly with the personal statement, about how you can demonstrate those core competencies.
It also sounds like that'd be understanding how you can articulate them using the anatomy of the applicant or other tools is something that you're able to do during your interview. Should you get interviews, that's a really good point where you can start talking about some things that maybe you weren't able to include in some of your initial application materials, and share that information. And I know we're going to be talking in a couple of weeks about the recorded video interviews, and we have some interview sessions that are going to be a little further down the line later in the summer. So
I know, yeah, we're not even touching the secondaries or written interview questions. You pay attention to what they're valuing, and that'll be the next question. But interviews for sure. You can prepare based on the competencies too.
Okay, and I just wanted to highlight again, if you have any questions specifically about the competencies, ideally, or if you have any just general admissions questions, please feel free to put those in the comments and we will try to get to them and answer those questions here. So transitioning, as you mentioned, to the next one, are some competencies more important than others? Obviously, there's 11 competencies. Are some more important? Are there some that are an absolute requirement? I guess all, like you said, everybody has all of these competencies developed to some degree, but are there some more important than others?
So obviously the definitions are written such that they all should have sort of some level of equal weight with each other. And I don't think it's necessarily, one is significantly more important than others. I think all of the elements appear in different combinations, but they all sort of contribute to certain behaviors that lend to success in health professional fields. So in terms of, what are some competencies that are more important than others? Well, if you have a school, for example, they also will articulate what their core values are. Maybe they'll do some modification of competencies of their own. And so you can make a judgment of how, what overlaps or what doesn't. But as an example, if you have a school that's very much focused on small group, community-based health, then they're going to be looking for certain things. Certainly, they know that you have all 11, but some of the areas of the nuances are really important, especially as it aligns with the types of patients that they wish to serve in their school or in their program or the hospital. So, if you are interested in, again, working with others or at least caring for others, you may have the empathy and compassion. I think perhaps that's the most universal, and I won't know if I guess you can argue that is the most important, but also the one that I think people really, lean so heavily on that they forget to talk about others. And I think it's the importance is how it all relates in context. So if you're again, rural-oriented school, very service-oriented, so you really obviously need to have the empathy and compassion for others. You also probably need to know and understand a little bit more about culture. And so the cultural humility side, if you've never ever been to a very highly rural part of this country where this school happens to belong, are you the type of person that would really embrace the opportunity to really learn about what that community is like or those counties are like around there? Do you understand the importance of being reliable and dependable based on their lives and their schedules? And, they want to trust you as a future healthcare professional. What are some of the ethical dilemmas that you may or may not have? Because you may be completely, you may be in a very challenged situation where, you have to turn somebody away because you clearly don't have materials with you, or you're worried because, you may be working with someone who is underage. And so you've got to get through a series of consents. But there may be some things that sort of block you from being able to do that. So there are so many different things that I think, depending on the situation, the question is the maturity you have really puts you in a situation where you can really succeed? Do you have the so-called time management skills that allow you to be reliable, that allow you to behave in a very ethical manner in terms of with integrity, so that you don't take shortcuts, or you refuse to take shortcuts, and certainly encourage others not to take shortcuts. Those are just important. I think they're important, and the issue is going to be not necessarily which ones are more important, but where are the areas that you need improvement upon, and what do these schools do to give you a chance to really work on and focus on the improvement of maybe areas you haven't had a chance to really develop, or may not be able to recognize how important those competencies are in certain activities. So part of it is going to be really dependent on the school, the mission fit, and I think certainly dependent on what the school offers to really help you get to where you want to be in terms of being the type of professional that you want. Maybe another example, I'll just throw in one last example in here, just because it's on my mind right now. There's a lot of focus on self-reflection. There's a lot of focus as a professional in terms of becoming a professional, knowing how to self-reflect on things that were challenging to you. That type of written communication is very key and very important for you to be able to process maybe a lot of the different emotions you've had when it comes to a very bad day, or a very bad set of cases, or something that really went haywire or wrong, or even something that went amazingly well. For those programs that really focus so heavily on your ability to reflect and to write in narrative form what you've been able to see, you can kind of guess what competencies wind up really being very important if you go in that direction. So be mindful, and when you look at other programs, how are they addressing the competencies too? Because they expect you to have them, and hopefully you should expect them to help you, be as complete a doctor as you can be on all of those competencies.
Yeah, and you talked a little bit about mission fit. We did do an earlier session on mission fit, so definitely check out our YouTube channel if you are curious about how you can assess mission fit and what things you should look for in order to understand what the mission of an organization is. And again, if anybody has any questions, please feel free to put those in the comments there. We can try and answer them. We did get one question, but I think it's a little specific to that person's situation.
Yeah.
Did you want to try and address that, or do you think, or should we ask that person to go to the Ask the Experts?
Well, I definitely would recommend that he goes to the Ask the Experts, given the he or she, excuse me, given the sort of specific nature of of your training. One of the things that, especially, this is a person who is an international trained dentist and probably wants to be admitted into an international dentist program somewhere around the country. And again, there are competencies that are there too. So again, Amanpreet, please don't hesitate. If you do not already have an avatar on Student Doctor Network forums, please create one for yourself in an anonymizing way. And you can feel free to ask the experts. We have a confidential section that you can ask specific questions, but we also have an open forum for international dentists in the dental students and residents area too. So please don't hesitate. Go there too. We often will have some people who are involved in international dentist programs, or I hope many of them are still there and can probably help you out. Do I think you should pursue your dream in terms of practicing dentistry in the United States? I have no reason why I should discourage you. One of the things that certainly comes is the matter of fact is you need to understand what are those international dentist programs looking for. In many cases, as we mentioned before, GPA is one thing, but you probably got a GPA in India and not in the United States. So equivalent GPA calculations can be misleading, and of course, that's not what I think an international dentist program really is looking for. Yes, we do want you to be able to, process information very quickly, but you're really there in a very intensive clinical program. We want to know you have the right hand skills and that you have a level of sophistication and competency in the procedures that you're doing, that you can really, hang on, you can really progress as appropriate in the curriculum, and you can really be a benefit to the members of the dental clinic, including the traditional pre-doctoral students that are there. So, I can't say anything about how you did because I don't know how you did on the board exams. I can't answer for that for you, but I would certainly encourage you to contact the admissions teams at all the schools for which you're interested in attending their IDPs, and just ask them, what would you look for? How do I find out? What are the characteristics you're looking for? Back to the competencies again, you have to also still demonstrate that you have an understanding of those competencies. In many cases, many of the dental IDPs also do a situational judgment test. So again, we're testing you on your English oral communication skills in a lot of cases, as well as your hand skills. Because for all the people who run the dental clinic, they have their patients in mind. And so you've got to be a little closer to being as competent as a third or fourth year dental student if you're going through an advanced standing program that you're looking at. So I mean, 12 months of dental assisting, at least you've gotten some experience while you've been in the United States. Keep doing it. Try doing as much as you can, get certification, x-rays, whatever you can do to show your capacity to continue learning. Again, another competency. And we'll just see what happens. I mean, it's tough to get in, but really, really lean and leverage on other people who are currently in international dentist programs, and we'll just sort of see what happens. It isn't, I admit it's not an easy path, but on the other hand, it's certainly possible.
Okay, great. And again, if you have a question, feel free to put those in the comments, or if you have a question and you'd like to get our panel of experts to answer them, go to our expert advice area on the forums. It's the very top area of the forums, and you can ask your question confidentially, or you could potentially ask it in the general forums and get responses there. There's a lot of great knowledge out there that can help you with your decisions on what you want to do, as well as give you some advice on how to best approach things. Yeah. If we don't have any additional questions right now on competencies, is there anything else that you wanted to add to close out this session?
Well, I definitely want to still encourage you as you're making if you've already made school lists or you're in the process of looking at schools, I really still encourage you, as much as we really talked about the core competencies, I really want you to really look carefully at those technical standards, see what they're writing, how they articulate themselves, what they're looking for. You'd be very surprised about certain specific statements in the technical standards that might give you insight as an applicant. Again, I'm looking at the sample one that I'm of the other technical standards document for a pharmacy program that I'm looking at. And one of the things that's really clear, and again, it's not in an area where you see it under their admissions site, although it ought to be, or for most schools, it probably is. But that's not usually a page that everyone will hit. But I would strongly encourage you to do so. This particular pharmacy program it states that the expectation they have for applicants, especially when it comes to tactile, motor coordination, and sensory ability, they should have sufficient motor function to conduct basic laboratory experiments, pharmaceutical preparation, compounding activities, and physical assessment techniques, because that's, of course, what you're going to do as a pharmacist. Must have the ability to safely and effectively operate various types of laboratory and patient care equipment, such as prescription weights and balances, a glucose meter, stethoscope, pulmonary devices, and a sphygmomanometer, measures blood pressure. Sufficient motor function, tactile ability, and sensory abilities are required to attend and participate effectively in all classrooms, laboratories, conferences, clinical settings, and activities that are part of the curriculum. So, I mean, sometimes it's really well spelled out about why you need to have these skills. And certainly for pharmacy, it's, all your work in chemistry and chemistry labs really is important to that end, needless to say. I again go back to dentistry, since that's my wheelhouse. There are a handful of schools that will test you on your motor skills if you do for in-person interviews. So, hopefully they won't make it a surprise, but hopefully they'll tell you, give you an idea of how they evaluate your hand skills, at least on the spot. Certainly in the era now of generative AI, creating all these essays or possibly helping everybody with essays, more and more schools, I'm fairly certain, are going to resort to having candidates for interviews sit down and you get 30 minutes to write something, based on some essay prompt. And all you have is your good old-fashioned pencil and a good old-fashioned blue book or whatever document that they have. And you actually have to write, with that pen or pencil into that book, your response to a set of questions. I mean, that's going to happen. And, that's important for you to be aware of and be prepared for, because we really want to have as good a complete picture that not just you're a great student to have, but you're capable of passing our courses. I will also put a little bit of a mention that, we also will not and should not discriminate anybody on the basis of disability. That's still federal law. And if you have had accommodations ever before, make sure if you need accommodations throughout the throughout your interview phase of your application, that you ask for it. You ask the admissions office, hi, I'm sort of hard of hearing, or I need a little bit more time if you have this written component, because I have difficulty processing at the same speed as other people. You need to be upfront and talk to people about it in the application process so that you get the appropriate accommodations you are legally supposed to have, you are legally entitled to have. That's the thing, that even once you get into a health professions program, you are legally entitled to appropriate accommodation so that you are able to learn and also be evaluated for, as appropriate. There's no guarantee that you're going to get double time for every exam. And certainly for clinical exams, you likely will not get double time. That would be very challenging. Again, for dentists, I don't know if you want a simulated patient who would be very willing for you to work on them for twice the amount of time than regular. I mean, if you had to sit in a chair and you had 1 hour to sort of take care of a cavity and something like that, you can't do it until you can try to ask for 2 hours or 3 hours. I don't know whether, there's no guarantee you will get it. So again, it has to be reasonable, and there's standards that I'm sure the schools will have regarding your technical standards, but it's really important that you read what they are, you understand what questions to ask, especially if you have some disabilities that you're sort of afraid to disclose. But if you have had accommodations before, please don't hesitate to collect your documentation and just ask for the accommodations you're entitled to. That's really important, because if you don't and you don't do well, then again, the technical standards will come into play. So please, be very mindful about what those standards really are about. And again, you'd be very surprised what you will learn, and that might give you a bit more insight about a program and what they're looking for.
Great. Well, thank you so much for giving us that deep dive onto competencies, and also covering the technical standards and all of the different things that you need to be able to do and be in order to be successful in not only in getting into a program, but also successfully completing and becoming a strong healthcare provider. That's it for today's session. We're going to take off next week for Father's Day, but we will be back in 2 weeks on the 22nd, I believe, for the recorded video interviews. So we'll be talking about recorded video interviews and how those are part of the application process. So good evening or good night for everybody out there, and we hope you have a good rest of your evening. Thank you, Dr. Chuck, again.
Great. Thanks, everybody.